Hi, my name is Xaviour Walker. I'm a geriatrics fellow and a public health and preventative medicine physician working at the University of California, Irvine. I'm very excited to talk to you today about healthy aging. This is just a disclaimer slide. So what exactly is healthy aging? Well, when we think about healthy aging, obviously it comes on a spectrum. From the day you're born to the day we pass away, we want to live at the maximum of our potential. So wherever you fall on that continuum of age, we want to get the maximum benefit for you. And I'm going to talk about some lifestyle interventions that you can make in your own clinic and with your patients to improve their sense of well-being and able to make them healthily age. When we look at the spectrum of healthy aging, if you look on the column of increased vitality, we all want to live as long as we can at the best of our potential. However, unfortunately, because of medical illnesses, many of us can get hospitalizations and different diseases, and this can increase disability. This is what we call chronic disease. What we really want to do is move people to the right of the curve and then allow them to live a more meaningful life by improving their lifestyle and other things in terms of the mental and physical well-being. So I want to share with you some practical tips, 5 ways to bring in healthy aging into your clinic, because I know you're very busy at the moment, and these are some things that you can do that don't take much time, but will have a lot of impact on your patients. Number 1, having purpose and meaning. It's really important for your patients to feel they have purpose and meaning in their life. If we look at the Japanese, the Okinawans who live the longest in the world, they have a word called ikigai, which means the reason that I get up in the morning. So it's really important, talk to your patients, find a little bit more about their social situation, what they did when they were growing up, and what they like to enjoy, because this is the key in trying to help them find something they enjoy and really get in those lifestyle interventions. When we think about lifestyle, it really comes down to 3 words: eat, move, and sleep. I'm going to quickly give you 3 tips looking at those things, which are the fundamentals of living. So eating whole foods and mainly plants. Each one of those words is vitally important. Whole foods. We think about whole foods, we want to think of foods that are naturally produced, things that your grandparents would recognize, things are not processed, and preferably locally. If it's from your garden, even better. And mostly plants. We know that vegetables and salads are one of the best things you can eat, along with fruit and nuts. These sort of things are vitally important and have a lot of nutrients. So one intervention you can talk to your patients really increase the amount of whole foods and mainly plants that they eat. Moving naturally. When we think of exercise, we kind of think of the 3 times a week to the gym, some walking, which I truly advocate for. Obviously, we want to get at least 30 minutes of exercise a day, but I want to bring to the concept of moving naturally. This is that people move throughout the day, they're not sedentary, but really that they're living a lifestyle that is active, whether it's doing their chores, getting out in the garden, and really getting amongst the community. Sleep hygiene. When I think of sleep hygiene, this is one of the best things that we can offer our patients. A lot of our elderly patients especially have problems sleeping. And I think about sleep like the way a baby is. When we want to get good sleep for a baby, we think about their routine and we think about optimizing the best possible sleep for them. And the same goes when we age. Get up at the same time, exercise in the morning, have the meals around the same time, and then about after your meals, really start to shut down. And this, what I mean by this, have a time where you're saying all the computers off, your phones, we have a lot of blue light in our phones, and this really can be stimulating to suppressing melatonin release, which can interfere with your sleep. And the other thing is just really optimizing your bedroom situation, not having a television in your bedroom, and really making sure your room is cool and comfortable. So sleep hygiene is a really good thing you can offer your patients, and there's a lot of great handouts that you can give to them on this. 3 is socialization. It's vitally important that your patients get amongst the community, interact with their friends, and don't get isolated. We know that if patients get isolated, they get more depressed, and this can lead to unhappiness, and really it's hard for them to get active on some of the interventions we do. So as people age, really talk about who's your friend networks, what things you enjoy, getting out in the community. And number 4 is optimize the annual wellness visit. Every patient over 65 is eligible for an annual wellness visit under Medicare. This is an excellent opportunity for you to look at their immunizations, make sure they're up to date, check out their weight, check out what they're doing actively and socially to try to increase some of the things I've talked about. It's also looking at risk behaviors, whether it might be alcohol or their falls risk. But really optimize this and looking at different measures of flow charts that you can do in your clinic and make this a really effective visit for your patients. And number 5 is leverage community resources. None of us can do this alone. And it's very time consuming if you have a lot of things to talk about with your patients. So at minimum, you should really know where your senior center or adult daycare is so you can refer your patients to get these different services I've talked about. Think about nutritional services, social work, and case managers, and really find out what's in your community. If you get a chance, visit some of these communities and your resources, and you'll really be struck by the immense amount of different resources they offer. So just summarizing, the 5 things that I think that you could do to bring healthy aging in your community and help your patients. 1, having purpose and meaning. 2, eat whole foods, mainly plants. Move naturally along with the regular exercises that the patient should be doing. Sleep hygiene, talking about really getting good quality of sleep and different things that you can do to help them. 3, socialization, make sure they don't get isolated. 4, optimize that annual wellness visit and really make it a part of your patient care. And last of all, activate the community resources and make your clinic part of the community. I hope these things have helped. Obviously, healthy aging is a large topic on itself, but I think if we start somewhere, this is a really good opportunity to make people age very healthily. Thank you very much for your time.